Hello, hi. So this is our live again at RJ Clinic Atiwo Damansara. So I'm Dr. Chok, and this is.
I'm Dr. Carol.
So today we are actually talking a very interesting and very crucial and important topic, which is the legality aspect as well as all the other aspects of medical aesthetic treatment in Malaysia. So we need to tell the public that actually how this is done and what is the correct avenue or to go to if you want to do medical aesthetic treatments. So I'll let Dr. Carol speak a few words first before we actually go into the details, all right?
Hi everyone. So I'm Dr. Carol from RJ Clinic Ativo. So as we all know, recently there's a lot of news on invasive methods of injections and everything, botched surgeries and all that. So today we want to touch a bit on these medical aspects of all these procedures, aesthetic procedures, especially in Malaysia. What is the difference? Because some of the news that we heard is actually in Singapore recently, and then in Hong Kong. So what is the difference over there, medical legally, and over in Malaysia as well? So today, Dr. Chok will also touch on the technicality aspect of being a doctor and an aesthetic doctor, because Dr. Chok has he's a very experienced aesthetician, physician in Malaysia as well. So we would hear from him his experiences so far, so many years, and what are the side effects of all these, and what kind of experience have he on complications, and what cases have he seen before. So, okay, so let me pass back the mic to Dr. Chia.
So today we are going to speak mainly on English, and I will mix a bit of Huayu, and Dr. Carol will try to interpret what we say into a very brief Bahasa Malaysia summary. Because we are in Malaysia, right, we have to know 3 languages. Because my Bahasa tidak berapa bagus, that's why I have invited Dr. Carol to help me in this aspect. So 就今天呢，我们会讲这个医学美容在马来西亚是怎么样的一个情况很多人就误以为讲医学美容是一个蛮容易做的事情，就是没有什么大碍嘛，就是谁都可以去找来打一下，然后就到最后就是问题就出现在身体上，然后才后悔所以今天呢，我们就能够就很详细的，我跟 Dr. Carol 会很详细的就在这边跟大家解释，在马来西亚是怎么样的一个情况，是谁能够打，还是怎么样有什么法律在保护这个群众跟消费者So the first aspect we will go to, right, is actually in Malaysia, right, we know there are a few laws that protects consumers. Although it's not very widely known, but there are laws that protect consumer that so that you are being protected as a consumer as well as a patient. So there are a few acts. Number one is what we call the Public Healthcare Act, PHFSA Act. This is to basically tell you that where should these procedures right being performed. So public health facility, PH facility means you cannot perform medical procedures, let's say in a restaurant, cannot. You cannot perform medical procedures in a hotel.
Yes. Yeah, recently there's a lot of cases in hotel as well. So this medical act most of the time is present to protect consumer when you have this when you are doing this kind of treatment. Kebanyakan kalau nak bercerita tentang rawatan kecantikan, kebanyakan macam mana nak kata, kebanyakan rawatan dijalankan di tempat-tempat yang tertentu seperti salon kecantikan. Ada yang kalau kamu tengok viral video dekat Facebook, kebanyakan yang ada komplikasi semuanya dibuat di either salon kecantikan atau di hotel, dalam bilik hotel sebagainya. So jadi tempat-tempat sebegini sepatutnya tiada rawatan kecantikan yang boleh dilaksanakan sebab ini adalah undang-undang yang adalah undang-undang untuk protect kita sebagai consumer. Yeah. So
so the intention of us doing this video is not to make war with beauticians. To state it very clearly, we are supposed to protect the consumer point of view. I mean, you can perform any procedures that does not involve injections in beauty salon, such as facial massage, lymphatic drainage, whatever you can imagine that doesn't involve injections. I mean, that is very, very, very safe to be performed in a beauty salon. But when it involves injection, needles, a dangerous laser device that can blind your eye and burn your skin, that should be performed and under the law must be performed in a public health facility, which means a hospital or a clinic. Alright? So I don't know whether you have all noticed that all these beauty salons or so-called self-proclaimed experts, they like to do a road show. They will go to Penang for 2 days, Ipoh for 2 days, Seremban for 2 days, and Johor Bahru for 2 days. Do you know what is the reason why they don't have a fixed place? So under this act, right, if you go into the legality aspect of this PHFSA Act, you must be caught red-handed. That means you must go break the hotel door on the spot.
It's like that dentist case. Do you remember? There's a girl who does braces for people in the hotel room. So she was caught and charged in court because they caught her in the act in the hotel room. She was doing orthodontic braces for people, and she is only like what, 20 something. She's not even a dentist basically. Yeah. So all these kind of cases has to be caught in the act. So as a proof. So it's quite difficult if you are having a roadshow and you are moving around. So unless you are being targeted by and seen by the authorities, then if not, it's quite difficult. On top of that, consumer will also keep going for this because they are not aware of the complication of seeking treatment from all these unlicensed beautician to perform these treatments. If you say beautician can do facial and everything, yes, but not when it involves deeper into the skin, right? So by right, the law says that.
So now you know that why they travel around the country is to prevent the chances, to reduce the chances of being caught red-handed. Just like how syndicates run around, they don't stay in one place very, very long. Similarly, these beauty salons, self-proclaimed experts, they will run around the country to prevent being caught red-handed. But rest assured that last year, our Minister of Health, he actually said that he will actually personally increase the enforcement to curb this kind of illegal activities in the country. So that is what we call PHFSA, Public Healthcare Facility Act. So we go on to the next act. It's called Medical Act. Medical Act basically tells you that doctor is a doctor lah. You must go through university 5 years, go through housemanship, go through training, then you self-proclaim as a medical doctor. You can't you can't go and say that, I am a doctor because I went to a 5-day course and someone say I am a doctor. No, cannot. Under this Medical Act says that there's a certain rules and training or which university you go to is being recognized or not recognized, and you are a doctor. And under this act, a fake doctor can be charged up to, not mistaken, 20 years or 10 years, 20 years.
PhD also not doctor, right?
No, those are bracket doctor, bracket doctorate. Yes. Okay.
Doctor, as a medical doctor, is somebody who has a degree. You can see the title doctor, and then at the back we will follow by MD or MBBS. This is a standard doctor abbreviation. But if you see somebody with doctor title in front and then at the back is PhD, that's considered a doctorate, not a doctor. Yeah. Correct?
So under this Medical Act as well, it's also stated that you can't proclaim yourself as a doctor. If you are a PhD doctor, you must bracket it. And if you are a medical doctor, and you must go through a certain hours or years of training before you are proclaimed as a doctor, registered as a doctor in Malaysian law, right?
But number one, we have serial number also for doctor. The number of the doctor as well to certify if the doctor is a true doctor or not. That is under Malaysian Medical Council, correct? MMC.
So we move on to the next act. It's called Poison Act. So as you all know, the doctors we use like botulinum toxin or Botox or fillers or some other medication. Yeah, Rotogen or medications that actually to help us to achieve what we want on the face and body. So a lot of them are under this Poison Act because they can kill, right? Just that you heard in Hong Kong or Singapore the Botox case that killed someone, but actually it's not Botox. But just to tell you, in very large amount, this botulinum toxin can kill. So it's under the Poison Act. Poison Act is something that is very serious. It's sort of like a special branch in the police that will catch people for carrying drugs. This is under the Poison Act. That means dadah lah, 吸毒啦，毒品的一个法律啊。So yeah.
Jadi kalau kita tadi secara kasar kita dah bagi tahu beberapa undang-undang di Malaysia yang boleh cover consumer. Jadi kalau kita cakap balik Medical Act, kebanyakan kalau kamu tengok balik doktor perlu ada latihan dan praktikal selama 5 tahun sebelum boleh graduate sebagai satu doktor, dan seterusnya kena ada latihan lagi 2 tahun dan baru boleh ada license sebagai doktor. Jadi kalau kamu tengok doktor, kebanyakannya DR dengan title kita kat depan. Kadang-kadang ada juga yang letak title di depan tapi dia hanya adalah PhD level. Jadi kalau PhD dia lain daripada doktor perubatan. Jadi kalau kamu pergi tengok pegawai perubatan kebanyakan adalah doktor medical dan dia ada license dan ada serial number tertentu. Kalau check balik serial number memang ada dalam website Malaysian Medical Council MMC website, dan kamu boleh sahkan sama ada doktor ini adalah doktor yang betul atau doktor yang mungkin macam mana kata PhD doktor atau dia adalah doktor yang tipu, okey, yang beli yang viral dekat Facebook semua tu, okey. Jadi kenapa kita nak kata pihak kerajaan perlu menguatkuasakan undang-undang adalah sebab kebanyakan ubat yang kita pakai dalam klinik kecantikan, klinik estetik adalah bawah undang-undang Poison Act juga. Sebab ubat yang kita pakai adalah ada juga yang boleh menjadi sangat bahaya, racun. Jadi ubat yang kita pakai semuanya perlu ada latihan, dan kalau dalam dos yang terlampau tinggi memang boleh membunuh. Jadi seperti dalam surat khabar ada kes-kes yang tiba-tiba meninggal dekat pusat kecantikan ke lepas suntikan semua tu. Ini adalah kes-kes luar biasa yang kita memang dah tahu memang ini adalah salah dari segi undang-undang. Sepatutnya memang tidak boleh rawatan dijalankan oleh bukan doktor perubatan.
So I think we have covered the legality aspect of medical aesthetic in Malaysia. So we move on to the technicality aspect, Dr. Carol. I think in this aspect I want to ask Dr. Carol, because I know Dr. Carol graduated in a very famous university in India. So I want to ask her a few questions. Actually, how many hours do you spend studying the anatomy? Anatomy means the structure of the body. Let's say the skin, the nerves, the muscle, the bone, the eyeball, the ear, the brain, the structure of the body. How long do you actually spend and to study this, and how many times have you been examined or asked the structure of the human body?
I think through throughout my medical training, it has been, this is a common bread and butter of being a doctor. I think Dr. Chok would agree as well, especially if you are an esthetician, aesthetic physician, because every day we are touching the skin, the muscle, and also the bones structure. I think we all spend the same amount of hours, but when I was in India, we use real cadavers. So it's real dead bodies, and I see them every morning for 1 year.
Your boyfriend?
Yes, they are literally like my family for 1 year, yes. So, yeah, every morning for 2 hours we would just train ourselves to identify all these human body parts, and that lasted me for about 1 year, and subsequently everything is ingrained in the brain. Yeah. So basically, we spend a lot of hours studying, but we need to emphasize that constant training is a must. So even now, you need at least 3 years for licensing. Correct. Yeah. So this is an important thing about being a licensed doctor.
So, as what Dr. Carol said, actually as a medical doctor, we spend a lot of time to understand and to memorize and to actually go on practical on human anatomy and the safety aspect of where to inject, where not to inject, what will happen if we inject here and there. So we spend years, not days, actually studying about human anatomy, and that's the practical aspect of a doctor. So of course, this kind of training, years of training, like what Dr. Carol said, cannot be replaced by a short course of 3 or 6 or maybe 12 days. It just cannot be done. I mean, can you just trust a pilot that has gone through a 5 days learning course? I mean, would you go to
Let me emphasize pilot to graduate, right? For pilot to graduate, they need to have minimum hours.
Yeah.
Minimum hours, that is like a minimum of maybe 10,000 hours. That's
Yes,
a minimum. So it's how much hours you put into practice, you know. So you are putting your hands in your face and your skin in the hands of somebody that is trained or not trained. So it really depends on consumer. If you are not aware of the level of expertise of the person, then if you choose the wrong thing and the wrong person to inject, it will be devastating. Complications can happen very frequently.
So in a very simple way, we can summarize in saying that doctors, medical doctors, especially those LCP certified doctors, are being well trained, as well they have enough numbers to make sure they are safe, so that the consumers are well protected. So it cannot be replaced by a self-proclaimed expert, by a beautician that says they have gone through Korea courses for maybe 12 days, 6 days or what, and they can start injecting you. No, I mean, the human body is not as simple as that. If it's that simple, then everybody can everybody can be a doctor, and we don't need doctors.
Yeah. So sebenarnya kalau rawatan seperti yang rawatan estetik di Malaysia, dia memang satu rawatan yang setiap rawatan ada risikonya. Tapi kalau di tangan orang yang tiada latihan bagus, tidak bertauliah, memang dia akan ada komplikasinya, dan komplikasi itu memang susah kita nak buat rawatan selepasnya. Kebanyakan pesakit yang datang kepada kita adalah selepas komplikasi dari apa yang diorang dah buat rawatan di luar. Jadi ada tak case? Do we have cases?
So Dr. Carol is fast forwarding. So she has moved on. She has moved on to the safety aspect of our discussion. So like we discussed just now, I mean, it's a very practical and very logical kind of question. Whether you would, if I know the pilot has maybe just 24-hour training instead of 10,000 training, I wouldn't step into the plane. I mean, most people with logical mind wouldn't step into the plane knowing that you will die. I mean, why would you want to step into the plane?
Because I don't know the pilot need 24 hours training.
Okay, so that is the logical way of. Similarly, in our field, Why would you want to let someone that has only 6 days or 12 days training to inject your face? I mean, that is your face. That represents you every day. People see you. The first thing they see is your face, and that's why if you know or the fact that the person has only 6 to 12 days of training, and is not a doctor, and if I am the consumer, I wouldn't want to be injected by them or believe what they say actually. So that is the safety aspect of this medical aesthetic treatment in Malaysia. So just now Dr. Carol was asking whether I have seen complication cases in Malaysia. I would actually, of course, they are very common, because I sit in a panel of key opinion leaders in Malaysia, and we have ophthalmologists, we have plastic surgeons, and we have a very famous aesthetic physicians. We all sit down and we all discuss all the cases. We classify them into the very serious and not very serious. Not serious. Okay, very serious means, of course, involves blindness, like nose disfigurement, scarring, this kind of problem. And necrosis. If it's not serious, some nodule, some lumps, some asymmetry, these kind of things, all not serious. So of course we have, I have heard in Malaysia there are serious complications such as blindness and disfigurement caused by beauticians, but they are not doctor. That's why they are not charged under the Medical Act. They are being charged as a silver suit. That means if you spoil my car, I will sue you so that you replace my car, something like that. Okay, you spoil my eye, so I sue you, replace my eye, something like a silver suit. A silver suit. So it's not under what we call criminal law. It's not kind of criminal act because they are not a doctor. So a lot of them are undergoing silver suit in Malaysia. I think if you search the keyword in Google, you manage to, I cannot name them, but you can see who are those are being in the silver suit. Because court cases are open to everybody, you can actually search them. So there are many blindness cases injected by beautician that are undergoing silver suit now. Okay, and of course those not so serious one, they will come to me. I have seen many of them, such as nodules, when you inject nodule, or silicone. Okay, this is very common problem in the silicone. When some of them injected into the nose or chin, they become very huge and become funny. They don't appear immediately after. The problem is this kind of silicone problem. They will come to you after 4 to 5 years, and when after 4 to 5 years, you probably have forgotten who was the one that inject your face. Yeah, so that is when you regret, and you have to spend a lot more money and downtime to undergo some procedures. So that is the thing.
So jadi seperti mana yang tadi Dr. Chok dah kata, kebanyakan kes di Malaysia adalah kes civil, di bawah mahkamah civil. Sebab apa? Mereka bukan doktor, jadi kita tak boleh macam mana nak kata, tidak boleh dibawa kes ni di bawah kes kriminal. Ya, jadi yang ni bukan kes yang senang. Yang kes-kes kebanyakannya adalah kes yang macam boleh komplikasi macam buta. Sebab kalau inject filler ada komplikasinya seperti buta, dan buta itu bukan sementara, adalah selama-lamanya. Dan dari segi kulit, dia boleh menyebabkan kulit jadi mati juga setempat, dan juga dia kalau macam silikon implant, dia boleh menyebabkan ketolan, kita panggil granuloma. Jadi ketolan tu mungkin hanya komplikasinya akan nampak lepas 4-5 tahun. Jadi dalam kes-kes begini, kebanyakannya sudah melepasi waktu yang mungkin kamu dah 4-5 tahun kamu dah tak ingat dah siapa yang tolong buat rawatannya, dan mungkin tak dapat cari pun orang tu. Kalau dari segi macam cari beautician dari Instagram, tengok review dekat Instagram kan. Jadi ini adalah komplikasi, dan ini sangat dari segi undang-undang memang salah, tapi kita tak boleh nak charge dia sebagai criminal juga sebab dia bukan doktor.
So I think we have a few pictures to roughly showcase to you what are the complications that you can see. So if you can see in this video, this is a picture of a lady that being injected by beautician for the eye circle. So you can see here what is going on is there is a lot of nodule going on here and here and here in the eye bag area. And of course, there are also some sort of necrosis or infection going on. I would rather think it's some sort of necrosis going on there because you can see the color is purplish and in color. So the blood flow into that area is not very, very good. So this is a very common case if you are being injected by a beautician and they don't know what they are doing and they inject into a vessel and or whatnot, and will block the blood supply to the area and will become like this. And of course, you can see a lot of nodule there. And the another aspect in this case is, of course, the material that's being injected and the skill is not there. Material being injected is, of course, is not the correct material. Once we can see in there, it's very, very hard and nodular. You can see. So and if you ask me this kind of case, how do you actually help them? You, of course, this is not too bad. You can go back to your normal self. But you probably have to spend another 10,000. Yeah. 10,000. Surgery, opening up, take it out, and hospitalize, and give some injection, antibiotics, this kind of thing. So so if you have to be safe than sorry, I would say. I mean, if you want to choose a place to beautify yourself, who doesn't want to beautify yourself? I mean, if you see Instagram, I also do a lot of treatment on myself, right? So you have to be safe than sorry in a sense. And then another one is, this is if you go nearer to see the chin and the nose, it has a lot, and especially the cheek here, it has a lot of this figament. This is the typical siliconoma. After you be injected for silicone, after 4 to 5 years, or maybe unlucky 10 years or lucky 3 years, you will have this kind of irregularities in your face. They grow after years, So that is a problem with siliconoma. And how do you resolve this kind of problem is there's no other way to take it out. It's a surgical kind of solution. You have to open up and actually dig it out. So, but when you dig, there's a lot of scarring, and there's no guarantee that you become your normal self anymore. All right. So this is silicone. Okay. So recently, last week, I saw one patient that came from where? Came from Negeri Sembilan. They came from Negeri Sembilan. She was a very pretty lady, and not this lady. This lady doesn't come from Negeri Sembilan. Okay, there's this Negeri Sembilan lady that was very pretty, but similar case, she has a lot of friends, and she trusted her friend to inject some treatment on her face, and now she smiles like this. She told me that her concern is asymmetry smile. So this is another problem when the beauticians do not know where to inject and the dosage or what they inject actually. They inject in a manner that the course taught them. The kursus taught them, the 12-day course. And when you use those techniques that are not individualized, I mean, every human is a bit different, you get problems like this. And it's because the muscle toxin works different way in both sides, and you get asymmetry in expression. Like this lady, you see her expression, the smile is already sengek. Okay. Yeah, so these are the few common things that we see in daily practice, the complications. Of course, when you ask, a lot of beauticians will fight back and say, of course, doctors do also got complication. Yes, we do, there are complications, but our complication rate is much, much, much lower as compared to in a untrained hand, and as well as unhygienic place. Okay, I would like to bring the aeroplane scenario again. Okay, let's say if a person that has only 1 or 2 days training, then he flies the aeroplane. And as compared to a pilot that has maybe 20 years experience in flying the plane, who would you think is higher risk in crashing the plane? So you go and figure it out. Both also has risk. I mean, when you step into the aeroplane, you know there's certain risk you will die on that day. But the risk, how high is the risk, is depends on how experienced or how good the pilot is. What do you think, Dr. Carol?
Yeah, you like to compare with pilot, right? I like to compare with P license. P license. So P license, whenever you see P license on the road, you'll be a bit scared, right? So that's the fear that you have when you go to beautician. Well, they are not.
They're not P, they're L.
They are not even. Yeah, they are L Latin.
L.
So basically, it's not that they are better in terms of technique in compared to us. Their cleanliness as well, because everything in clinic we sterilize it and we perform it in a very clean manner to prevent infection. Even the design of the clinic and the rooms are cleaned and we clean it in a septic way to prevent infection. But when you go to a beauty salon or a hotel room, it's actually full of germs even in the air. So you have to take a risk of whenever you're doing an injection there, you may have infection. Yeah, and we doctors, we know if we prescribe, if we do a treatment and there's a risk of infection or not, and we would normally give antibiotics, right? But for a beautician, they are not allowed to give you antibiotics anyway. So all these complicated cases with infection and with problems like lumps, unevenness, irregularity, they will come back to us, doctors, instead of going back to the beautician. Why? The beautician will actually lepas tangan, right? Beautician will tell you, oh, sorry, 我做不到这个东西，请你去找另外一个。
So, the last thing I will touch on is the price aspect. So, many people have the misconception that thinks that doctors charge exorbitant prices, that's why a beauty salon will be much cheaper. But in fact, to tell you the truth, that actually most of the doctors charge cheaper or not similar equal pricing to the beauty salon. So, I don't think doctors charge very exorbitant prices. Just that we are a bit truthful. We tell you the risks, what are the options, what are the expected results. We don't promise you the sky. We promise you the expected result. So, but the beautician promise you the sky. That's why you would tend to feel attracted to want to try their treatment. But whenever they have problems, they refer them to us. So that is the sad scenario in Malaysia. So I think what we are doing today is sort of open up your eyes and let you know what are the correct avenue and correct things to do if you want to actually improve your outlook with medical aesthetics. So our pricing is not very different or very high as compared to the beautician. If you have to spend like let's say you have a nodule that you come to me injected by a beautician, I will charge you 2,000 ringgit or 1,000 ringgit just to resolve that nodule. That will be
even pricier already.
Yeah, even pricier.
So kalau berbanding dari segi harga, memang dari segi harga kebanyakan akan cakap harga klinik lebih mahal daripada harga di salon kecantikan. Sebab apa kita rasa doktor punya harga lebih mahal? Sebab kita rasa sebagai doktor sekurang-kurangnya charge akan sama dengan salon kecantikan. Tapi kalau fikirkan balik, doktor adalah seseorang yang sudah ada training banyak tahun dan memang bertauliah dan berlisen untuk membuat rawatan sebegitu. Jadi dari segi harga, kalau kamu buat comparison, kalau dari salon kecantikan, sekiranya ada komplikasi, dia akan bagi tahu kamu, tolong pergi cari doktor sebab saya tak boleh buat apa-apa sudah. Atau dia akan push the blame to consumer. Dia akan kata mungkin kamu sendiri yang buat, kamu sendiri yang tidak menjaga kebersihan, makan salah. makan benda beracun, makan sambal ke apa ke. So jadi kamu ada jangkitan kuman, so kamu pergi jumpa doktor lah, macam tu. Jadi kalau kamu bandingkan harga, sebagai seorang doktor, kita bertanggungjawab terhadap pesakit kita. Kalau kita sudah buat rawatan tertentu dan ada risiko komplikasi tapi sangat-sangat kurang, kalau ada komplikasi pun kita akan meneruskan rawatannya. Kita tidak akan melepas tangan tanpa tanggungjawab macam sebegitu sahaja. So kalau macam kita rasa ada risiko untuk jangkitan kuman, kita akan bagi antibiotik. Tapi kalau di salon kecantikan, di bilik hotel, mana kamu nak cari orang tu pun susah. Jadi kebanyakannya kalau kamu bandingkan harga, memang berpatutan dengan apa follow up dan apa rawatan seterusnya yang kamu terima.
So money is one thing, but if you lose your sight is another thing, and if you lose your beauty of your nose is another thing that money cannot buy. Yeah, so that is the safety aspect that you have to bear in mind. If you still, after listening to us talking for half an hour, and you still decide to let your friend try, I mean your friend can try on anything else, but not your face and your body or your safety. They can't replace their nose for you, can they? I mean, can they cut their nose for you? I mean, if blind got out, they transplant eye for you. I don't think they will do that. If the case happen, what do you think?
Of course, they won't do that. I won't do that. But of course, like I said, we doctors, we are more responsible, and of course, definitely we know what we are doing. So in a case of complication as well, we would know how to handle it. So in comparison to a beautician, a normal beautician, or somebody that just takes a course and learn for 6 days, it's pretty difficult to tell how much responsibility the person is. So it's also your face, it's also the safety. So I guess all consumers have to bear in mind this first foremost is actually safety, not the price, because all these are considered enhancement to your face. So if there is a risk of complication, you will even lose your sight, you will lose your beauty. So do not take things lightly. Try to go to a proper licensed doctor and identify the risks before and think about it before you attempt to do anything to your face. That's what I would advise our consumers nowadays. And do not be attracted by false promises and false guarantee, and also reviews on Instagram and on Facebook. All this can be fake, I would say, one thing. And another thing, if they are not licensed as well, their technique is different. So they may inject appearance the same way as how doctors inject. Yeah, they may use the same cannula as well. But like Dr. Chok said, driver is different, pilot is different. Even though using the same car, same plane, but the risk is comparatively very different when the driver or the pilot is using, it's a different person, differently trained.
So I think we have actually covered a very wide area on medical aesthetics. I mean, legality-wise, safety aspect-wise, technicality-wise, we all covered today's price aspect-wise. We also covered today. So I think we end it today. I think it's a bit long, but never mind. I mean, in the good view of letting our consumers know better in Malaysia, I don't mind representing my society, my industry to tell you this, although it doesn't help me in any way. Maybe my partner will say, hey, actually, why are you helping the other doctors? But never mind. I mean, in that way, we grow together. I mean, this is the new era of Malaysia. In good faith, I think we should look for a better avenue for our medical aesthetics, safety. Okay, we see you again in our next live, and hopefully you enjoy the week. It's still early, Tuesday, right? Not Friday yet.
No. So I think we'll just stay tuned for our next live. Next live probably we'll do some demo as well. Yeah. Okay. So that's all from RJ Cleaning Activo. Goodbye.